Today I'll discuss the case of a young man who presented to me 2 months after a motor vehicle accident, a car accident. His complaints were neck tightness, decreased rotation of the neck, pain and discomfort in the neck that was in the neck that extended a little bit to the left into the left upper tract area, as well as mild to slightly moderate headaches behind the eyes and in the forehead bilaterally. His presentation was relatively unchanging since 2 months ago. He knows he felt better when he ran, but otherwise symptoms were variable, not enough for him to seek x-rays or urgent care due to the motor vehicle accident. It was more minor in scope. So his ergonomics, he works with a laptop at home and at the office. He, relaxes like most people, kind of slouch sometimes, but we didn't think that posture was too much at play here. We thought more, obviously, since the inciting event was a car accident, that something was affected by that car accident. No major red flags, no dizziness, nausea, tinnitus, vertigo, no difficulty with vision or speech or walking, and no imaging to this point. He just kind of presented to me after he spoke with his PCP, who said he or she had heard that the McKenzie method was good. So I use Robin McKenzie's principles as well as other orthopedic principles, of course, as part of my orthopedic evaluation and treatment. So that the verbal history, that was it, but that's the most salient point. Started 2 months ago, the car accident. So in terms of the physical exam, there are 8 motions of the neck. For this gentleman, I tested all of them. Testing the 8 motions of the neck takes, 1 to 2 minutes. It's pretty fast. Protrusion was normal, full range of motion. Flexion was full range of motion with some mild posterior pain. Retraction seemed normal. Extension I put as a min to moderate loss of extension with a slight deviation to the right. When you're really looking for it, I find that deviations are more common than you would think. That is, when the patient extends the neck, they go a little bit to the right or a little bit to the left. To me, they're typically going away from the side of the majority of the lesion. So if they're deviating right, I'm starting to think that something is not moving well on the left. Not always the case, but it's one piece of the puzzle of the dozens that I'm putting together to try to come to a root cause diagnosis. Lateral flexion, so side bending to the right, no loss with some tightness on the left. Lateral flexion to the left, no problems. Rotation to the right, no loss to minimal loss with tightness on the left and the center, and then rotation left was fine. So moving to the right with his neck was the main problem area, and then extension was limited with deviation. So we have some range of motion issues. Of those 8, 3 are problematic enough for me to care about. Now, when we looked at myotome, so I looked at upper extremity strength, triceps was weak on the left. I put it as 4+ out of 5. And thumb extension, I put that weak as 4+ out of 5 as well. So that speaks to a possible lower cervical lesion, since the lower cervical spine is where the nerves that control the triceps and the thumb and the fingers emerge. Not conclusively, but we're starting to think it's more lower cervical than upper or mid. So I did a nerve tension test lying down just to be, err on the side of caution. Although he didn't describe upper extremity symptoms, he did have upper extremity weakness, not pronounced enough for him to come in complaining of weakness, but in the physical exam, triceps and thumbs different right versus left. And he had some elbow discomfort at end range for both nerve tension tests left and right, but nothing extremely out of the ordinary. So that is those first 2 parts. The third part of my orthopedic evaluation is testing. For this gentleman, I decided the best testing would be repeated movement testing. So I didn't feel like doing any instability tests, any compression tests, any imaging testing at this juncture. I decided to do repeated movement testing, which is a test created by Robin McKenzie. So I did repeated movement testing of the cervical spine. I started with retraction. We did repeated retraction and then quickly add the overpressure because I thought it was safe and appropriate to add overpressure to get to end range for this gentleman based on his presentation of not being fragile or vulnerable or, extremely acute. And we did 4 sets of 10 or so, including me adding some pressure so he could feel what retraction feels like. Of all the movements or all the exercises that I give to patients, cervical spine retraction, I would say, is the most difficult. It's a very difficult movement for people to get correctly. It's something they never do. There's lots of ways to do it wrong. So I try to, for many people, do it passively, even gently, just so they can feel that gliding motion of what it should feel like when the neck moves back. It's parallel to the floor. It's not, I don't use the word chin tuck, like I've said, because that implies to a lot of people that they look down. Retraction is moving parallel to the floor, and it's the opposite of protrusion, which is what a lot of necks are in with prolonged laptop work or computer or phone work, for example. So when we did retraction, in repeated movement testing, we marked down what happens during and what happens after, and then what happens to the baselines. So for him, it produced neck pain when we did it. So it produced neck pain, but it wasn't worse afterwards. So we did retraction with overpressure. Produce, not worse. So I'm not really concerned if it hurts a little bit when you do something or hurts moderately when you do something if the after effects are improved. So we produced it when we did it, didn't hurt afterwards, and as a result, I noticed better baselines. So we'll just say B for better. Better rotation, better extension, better tricep strength, better thumb strength. When I do repeated movement testing, I decide which of the baselines are important enough to retest. Say he had 9 baselines. In the interest of time and in the interest of moving people a lot, so much so that you make the puzzle more difficult to comprehend, you make it fuzzier, I wouldn't do all 8 or 9 tests again. But for him, he only had 3 motions that I cared about and 2 muscles that I cared about. So that's 5. And they're pretty easy to test. So I just tested all 5 again. And they were all, I did 4. I didn't do the side bending again. So the rotation, the triceps, the extension, and the thumb, all 4 of those were better. So since we did about 40 of these in total, and I saw that there was a better response, for me, my clinical decision making was that was enough of a response for this to warrant more time. So his home program became just this. Every couple hours, I want you to do some retraction. I want you to be a little bit cautious about lots of time in protrusion or flexion. And I want you to come back and let me know how it feels. And I also said to him, sometimes headaches do better when we sustain the retraction. So if you have a headache and it's not going away, please try to hold this for a minute or 2, even if it temporarily gets worse. As you hold it in the position, sometimes it temporarily gets worse before it subsides. So experiment with that if you have a headache that's not changing with repeated retraction or just with time. So he came back about 3 days later, and he said, his verbal history was that, yes, he did the home exercise program. He did what I asked, and he was attentive to his posture. And one time he had a headache on the left, and he tried a 1-minute hold, and it did nothing. And so overall, my question is, as a result of doing this, do you feel worse, better, about the same? And he said, I feel about the same. So that was a little bit surprising for me, meaning I did expect him to come back saying things are better. So I had to figure out why he was the same. When I did the mechanical exam, I found that the triceps was now a 5. So that stayed better. That stayed a 5. The thumb was now a 5. His deviation was still there with cervical extension, but he had better extension. So he's getting almost to what I thought was end range. So he had more extension, and then his right side bending was still stiff on the left, and his right rotation was still stiff on the left. So those were still there. Increased extension, right rotation, right side bend, same. So mechanically, a little bit better, strength and extension better, movements of the cervical spine laterally not really changed. Then I always ask patients to show me how you did the home exercise. Can I see a set of what you did? And I don't really say, show me how you did the retraction with overpressure. I say, show me how you did the homework or the home program or the home exercise, because I don't want to tell them how to do it. I want to know exactly what they did. And so I had him to show me how he did the retraction with overpressure, and it wasn't quite exactly how I would like it. I don't think he was getting to end range. It is kind of more fighting it with his muscles. So because of that and the unchanging effect, I was like, we need to test retraction more to end range, more fluidly, more correctly, and see if there's an effect, because maybe that was the missing piece of the puzzle. Is just the performance of the retraction wasn't quite up to snuff to get the results that I was anticipating or that I wanted and that he wanted. So we did 10 or 20 retractions with overpressure correctly, moving well with his overpressure, and there wasn't a change in that right rotation and right side bend. So I felt confident to move on. We got what we needed out of the retraction, which is help with the muscle strength, but no overall effect with that lateral movement to the right. So I decided to next test more repeated movement testing. I went to retraction and extension. So retraction, extension, he was cautious about it, and I had to continually tell him, go to end range, go to end range, go to end range. I didn't add overpressure quite yet. I didn't want to because of that cautiousness. So we did it over the chair. We did about 3 sets of 10. And when he did it, also, it would produce, not worse, so it would produce central neck pain when he did it, but it didn't linger the pain afterwards. After we did it 10 times, he didn't notice effect. We did it 10 or 20 more times, and then all of a sudden he's like, oh, that feels completely normal. Going to the right side bend feels normal. An extension, I wrote still a mild deviation, but getting much further into end range. So because of that positive response, things that were better, I made that his new home program. And because it abolished symptoms turning to the right and improved the range of motion even more than we thought that he had, it seemed like he got even more than what I would have called probably his full range of motion. That became his homework. Repeated retraction, extension over a chair if possible, standing if sitting was not possible or there wasn't a good chair, about 10 every 2 hours. And I showed him how to add pressure to his chin to get to more end range of extension. We went over that, and I said, I don't think you're ready for that overpressure quite yet, because you're still kind of uneasy at end range. It's not very comfortable for you, especially coming out of it initially. So add that overpressure in a few days if you can, if it's tolerated. So I wanted to add more pressure after a few days, 2 or 3 days of doing it without the overpressure. I also told him, we're going to schedule for 5 or 6 days from now. However, I have a feeling you might be feeling normal by then. So if you are, please just let me know 48 hours in advance that we can cancel the appointment. And then we did have extra time to discuss what would a maintenance program look like for him. I said, if you cancel the appointment, we're going to go over it now, but I will give you a handout of what it means to keep your neck healthy. And again, for him, we didn't really have to dwell on posture because the contributing event, the inciting event, was a car accident. But I did want to make him aware about what neck positions were happening throughout the day. We talked about what it's like to look down, phone use, computer use, books, what running is, how he could maybe change it up and do some activities on his stomach. Scrolling on your phone can be done on your stomach, for example, which puts your neck into minimal or moderate extension. So we just talked about what a healthy neck is, and to me it's having all 8 ranges of motion full and pain-free, and understanding what full range of motion means. This is not full range of motion. You have to be able to extend your neck all the way. Rotation and side bend will vary individual to individual, as will movements in the sagittal plane, but they should always be full and pain-free. And for someone who's younger, I expect more range of motion. So those were his instructions, and he did end up letting me know we didn't need a 3rd appointment because he was doing fine. So I sent him the handout of how to keep your neck mobile, meaning you can go down in the frequency. You don't have to do this every 2 hours. start weaning from it, maybe every 3 hours, every 4 hours over the next couple of weeks until you find a maintenance program that works for you. Maintenance programs for people are going to be very different. Some people who've had chronic neck pain for 20 years, maybe who've had radiculopathy into the upper extremity, maybe they need to do this and a neck exercise twice a day. For other people, they had a problem like a car accident, they got jolted, their neck got a little tweaked. A joint derangement is what I would call it, since it responded rapidly to movement in a specific direction. Those people might not need it at all. They might just keep it in their back pocket if a problem ever recurs. For people like me, I've never had any major neck disorders. It gets tweaked from time to time, and I'll get left soreness in my shoulder, or I'll get some elbow stuff on my right. For me, maybe once a day I'll do a neck exercise just to make sure I maintain that extension, because like everyone else, I'm in a decent amount of flexion throughout my day. So I tell people the maintenance program is individualized to the person, but the goal is to keep healthy, full, painless range of motion in all 8 planes. And if you're doing that, if you have all that motion and no pain, then you don't need to be as on top of maintaining it, because you're just maintaining it with your normal actions throughout the day. So this case illustrates how what I would call, using Robin McKenzie's terminology, a joint derangement, a problem in a joint that when applied a specific movement repeatedly throughout the day restores all signs and symptoms. So it restores all mobility and all strength. And granted, I didn't see him to check out his extension, but I'm sure it's fine. You know, in the clinic, he could get to end range without the overpressure quite yet, but he was getting really good extension and the deviation was decreasing. So for him, a joint derangement would be the diagnosis. Repeatedly moving into one direction restores all signs and symptoms. These things can happen acutely. They're not, as we think, some people kind of overstate how lifestyle factors can contribute to them. Yes, they can happen from a lifestyle of only putting the neck into flexion or protrusion and never putting the neck into retraction or extension or even rotation or side bend. But they can also happen because there's an acute force to a joint, like a fall, like a car accident, like one night of sleeping in a weird position on a plane or in a bed. So the takeaway is that repeated movement testing for him was the most salient test. That's the one I chose to use. And if I didn't have this test, I'm not quite sure what diagnosis I would come to. Whiplash as a diagnosis is a bit ambiguous, if you ask me. For him, it doesn't seem like this would be a muscle problem, right? A muscle problem in the neck shouldn't be causing weakness in the triceps and the thumb, for example. So joint derangement, this fits the criteria for that. Loss or painful range of motion, it has that. Possible muscle weakness, yes, it has that. Possible nerve tension, no, not really present. And signs and symptoms abolished with movement in a specific direction. The diagnosis here for him fits. That's what I diagnosed him with. That became his home program. He now is weaning from doing this exercise as frequently and has a maintenance program to keep in his back pocket as he needs it for the rest of his life.